Which therapy is best for anxiety? There's so many to choose from. Is it hypnotherapy, CBT, EFT, counselling, EMDR, or one of the many others you may have heard of? If you wake up every morning feeling scared or anxious and dreading the day ahead, you've probably already been to see your doctor to try and understand why you're feeling like this. Your doctor has probably told you that this is to do with a neurotransmitter in the brain called serotonin, and he's probably prescribed you medication to boost your serotonin levels. These medications are certainly very effective, there's plenty of evidence for that, but there are some drawbacks. Firstly, some people will experience side effects. Secondly, once you start taking them, they can be very difficult to stop, and this is because you can experience discontinuation symptoms when you try to stop taking them. And thirdly, many people find that their bodies adjust to the medication, and as a result they need higher and higher doses, until eventually they're on the maximum dose. Some doctors will recommend a talk-in therapy, but unfortunately many other doctors focus only on the medication side of things, so you have to do your own research into finding out which sort of therapy is best for you. But with so many different types of therapy and everybody claiming their therapy is best, how do you know which therapies are actually effective for anxiety? Fortunately, a lot of very clever researchers have already done this for you, and I'm going to explain how they do it, so that you know that the information I'm going to give you in this video is evidence-based. The first level of research is called randomized controlled trials, in which a group of people are given a particular type of therapy. Another group of people, called the control group, are given no therapy at all, or a different type of therapy. They then compare the results of the therapy group with the results from the control group, and then they write a report to summarize their conclusion. There may be tens or even hundreds of these randomized controlled trials going on across the world, and all the results might differ slightly. In fact, some of the reports may be a little bit biased towards one particular type of therapy, particularly if it's written by somebody who specializes in that therapy. However, in a systematic review, any biased or low-quality randomized controlled trials are filtered out. The remaining trials are then subjected to statistical analysis in order to establish how effective the treatment is. A lot of these reports are published on trustworthy sites like the National Institutes of Health, and I've reviewed these reports, and I'm going to summarize what they say about the different treatments for anxiety. I'm going to start with one of the most widely used therapies for anxiety, which is cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, looks at how your thoughts and your behaviors can create physical symptoms and feelings of anxiety, all based around your beliefs, and how by changing your behaviors and your way of thinking, you can reduce your anxiety. Here is what some of the systematic reviews said about CBT. CBT is an efficacious treatment for anxiety. The evidence base of CBT is very strong, and especially for treating anxiety disorders. It also says CBT can be recommended as a gold standard in the treatment of patients with anxiety disorders. Eye movement desensitization and reprocessing, or EMDR, is predominantly used to treat post-traumatic stress disorder. It involves recalling distressing images from the past, while the therapist directs you to perform certain eye movements. How or why EMDR works is hotly debated, but this is what a systematic review had to say about EMDR. 24 randomized controlled trials support the positive effects of EMDR therapy in the treatment of emotional trauma and other adverse life experiences. Another hotly debated therapy is emotional freedom therapy, or EFT. EFT involves tapping on supposed meridian points around the face and body while repeating positive affirmations. These meridian points are similar to those used in acupressure or acupuncture, and as a result, EFT is viewed by many as an alternative therapy. The research I found on EFT was mixed. One study said the emotional freedom technique treatment demonstrated a significant decrease in anxiety scores, even when accounting for the effect size of control treatment. Some researchers have tried to debunk EFT. In one experiment, they took one group who would tap on the meridian points, another group who would tap on random points across the body, and even another group who tapped on points on a doll. What they found was that every experimental group had a similar reduction in fear, suggesting it does not matter where you tap or if you tap at all. Now, the EFT proponents argued that the fingers themselves have meridian points in, and that would explain why all the groups that were tapping saw benefits. But I find that a bit of a strange argument, because if there's very specific meridian points to tap, how would you get the same benefit from just tapping anywhere purely through the meridians in the fingers? So to me, it seemed a bit of a weak argument, and despite lots of studies, I am slightly skeptical about this. However, it doesn't really matter how it works. The studies do show that it can be an effective way of treating anxiety, so I certainly wouldn't rule it out. Hypnotherapy uses focused attention and relaxation to make positive suggestions to the subconscious mind. One review said the evidence was insufficient to support the use of hypnosis for the treatment of anxiety. Another review stated evidence is negative or insufficient to support the efficacy of hypnosis in chronic anxiety disorders in any categories whatsoever. However, a more positive review stated that the average participant treated with hypnosis improved more than about 84% of controlled participants. It also found it was more effective when combined with other treatments than it is on its own. Most counsellors have trained in multiple therapies. Therefore, they should be the first choice for the treatment of any anxiety disorder. It's difficult to find data on the efficacy of counselling because different counsellors use different approaches. However, most modern counsellors have at least trained in cognitive behavioural therapy, which is shown to be effective for anxiety disorders. However, CBT does not work for everybody. The counsellor can help you understand why CBT may not be working for you, and maybe suggest another approach. All therapies have their advantages and disadvantages, and it's really about finding what works best for you. There is no one-size-fits-all. One thing is certain though, most anxiety disorders, when left untreated, will get worse. So the sooner you seek help from a therapist of whatever type, the better. This is one of many videos that I've made on anxiety disorders, so if you found it useful, please like and subscribe to my channel.